I'm here with Owen Murphy, who is an intern doctor. Owen, can you just tell me a little bit about the conditions you're working? You told me you worked a night shift last night. Could you just maybe tell me a little bit about that?
Well, basically, we have a situation in hospitals in the HSE where there's chronic understaffing, under funding of resources. There's a massive trolley crisis. Only last night in the hospital I was working in, there was over 40 people waiting in the emergency department. So you do have a case of resources and staffing really being put under pressure. You've got doctors there that are covering massive amounts of beds. You have nurses that are trying to cover wards with minimal cover, and everybody's doing their best. They're putting in massive shifts, both in effort and time, to give people the healthcare they deserve. But as we've seen in the last nearly decade of Fine Gael governance, there's been cuts that have been underplaced to the healthcare service, and the needs of people in Ireland, both in age and in chronic disease, has increased, and this increase of healthcare burden hasn't been matched by an increase of funding. So it is a struggle, but what can be said about the healthcare workers is there's great cooperation both between doctors amongst themselves and between doctors and nurses and healthcare assistants. So that is something to be optimistic about. That there is great work ethic there. The problem is just funding and a lack of planning for the government. What are they going to do? Are they going to fix this crisis? It's been a crisis for a long time. How long is a crisis a crisis? How long is it till it's normalised completely?
And tell me a little bit about the upcoming strike action, because there was a vote taken to take industrial action, and what do you think of this?
So in December there was a ballot amongst the nurses to reject the public sector pay deal that was being offered to them, which they overwhelmingly voted in 95% for strike action. Now this sort of action isn't taken lightly by the nurses. It's the second time ever in the history of the IMO that they have voted for an all-out strike. So this is a strike whereby emergency and life-saving provisions will be present, but there will be no basic services supplied, and I think this is massive. It's the only way to get through to the government, because at this stage it's been year in year out of nurses, especially with the surveys that the IMO have been conducting, that they're emigrating because of pay, they're emigrating because of staffing levels. They don't feel there's adequate career progression for them. They don't feel that they feel appreciated, and I think the sympathies of vast majority of healthcare workers in hospitals lie with them, and they don't see the strike as them trying to get more of the pie. They see the strike as a reaction to what has been government policy, and I think we could take a leaf out of their books, especially in the doctors as well, NCHDs, to list some of our grievances. Unless you're able to withdraw your labour, I don't think the government will take you seriously, and I think that the government would be quite afraid of a unified healthcare withdrawal of labour at the minute. So I think it would be very important for doctors and healthcare service workers, wherever they are, to come out and support the nurses. I think it's absolutely essential.
Yeah, and the government would say that they already have a deal with nurses, and that they simply can't afford to increase pay and all this. So what would you say to the government on those?
So I think this needs to be contextualised in the society we're living in at the minute. The average mortgage in Dublin is €350,000. The average staff nurse earns €30,000. It would require for a mortgage 3 staff nurses to secure a mortgage to get a house to live in. This is the equivalent also of one TD's salary. So the hypocrisy coming from the government that the nurses should stick to this measly pay deal that was come to by not the rank and file, but union leadership, that they should stick to this pay deal despite the fact that nurses in Ireland, compared to the OECD, are in the bottom third of nurses' pay. They're completely underpaid, and this is highlighted again and again with the internal surveys that are performed by universities and the IMO alike. I think that the government is out of touch. I think the people will massively come out and support the nurses' strike in this instance. Most definitely, we see most importantly, it's the mandate from the rank and file that cannot be ignored. And I think if most unions put a plebiscite, put a ballot to the members, they would see a much different picture than the agreements that are made behind closed doors on Kildare Street.
And as a young person in the health service, how do you see your future, and what do you think the future is going to be like for the Irish Health Service?
Unfortunately, as much as it pains me to say it, emigration is a real factor. It's a real factor of life. You have after intern year, there's surveys being conducted, and the facts are that there's close to 50% of interns will leave. they will go and they'll emigrate to another country, whether that is for staffing levels, whether that's for a more efficient system, whether that's for pay, and then it varies on how many people come back. But it goes all the way up to new consultancy posts. Consultants hired after 2012 are on a completely different pay scale to consultants before that. So you have nurses, junior doctors, consultants, all having pay problems, all having retention problems, all having recruitment problems, and with chronic understaffing, posts not being filled in rural hospitals. And this is just not acceptable for a supposed recovery and a supposed first world country to have this it's immense trolley crisis with over 100,000 trolleys last year, the highest in records since records began, and only 2 days ago the highest amount of trolleys in one night of 550 trolleys. Something has to be done, and I think we've come to the end of the tether whereby we can organise this social partnership, can deliver these pay agreements that will fix the problem. I don't think they will fix the problem. I think Sláintecare, which was an initiative signed cross-party agreement, signed by the sitting government, incumbent government, that this acknowledged that these agreements don't work. Yet we're continuing with this insanity. The nurses will be portrayed as radical. They'll be portrayed as unreasonable and irrational. But when you look at the current situation is radical, unreasonable, irrational and unsafe, and I think the only rational response is for a strike action, and is for workers to stand up, healthcare workers of all branches, allied health with physios, nurses and junior doctors, and even consultants have to really stick up for themselves here and say that we're not going to accept the austerity measures that are brought in 2008. We didn't wreak havoc upon the economy. We all know who's the culprits of that. It wasn't the workers that are clocking in day out on their shifts. We need as much public support as possible for the strike on the 30th of January. It means, in these strike actions, when there is so many actors at play, we have different unions that come out with different positions, because different unions have signed up to these public sector agreements. Some leaderships of these unions will feel aggrieved that a union has pulled out and it's called for strike action, but it's up to the rank and file membership and the public to express support for these things, and that is the way that we will affect change. And so the 30th of January, I feel that if the nurses can pull through and stick to the guns in the talks, there might be need for a strike. But if there is, I reckon it'll get the government listening fairly quickly, and hopefully there won't be any more need for strike action, because nurses and healthcare workers don't take strike action lightly. We care about our patients, we want them to be safe, but at the same time, we're human beings as well. Our working conditions matter and our pay agreements matter, and we feel like we just need to listen to.